We're going to move down to the dural tube evaluation. We've completed the work with the intracranial membrane system, and we've completed the mobilization. We've also mobilized the occiput and the sacrum. So what we want to do now is pay a little special attention to the dural tube. And in order to do that, I'm going to put one hand under the sacrum, and you can just roll up here. You can see my hand is just holding the sacrum very nicely, and the other hand under the occiput. And what I want to do is I want to move the dural tube up and down. Remember, it has a centimeter or two of movement that it's able to accomplish inside the spinal canal. So I'm going to traction toward the head on the dural tube using the occiput as the handle on the cephalad end. And when I get all the slack taken up there, which is now I'm beginning to feel the sacrum pull toward the head, I'm going to reverse, and I'm going to take the sacrum inferiorly and get the dural tube to express its traction upon the occiput. And I want to see how much space I have between there. She has a nice mobile dural tube in there. Some people who've had injuries, they may have had back surgeries, they may have had cord tumors or things like that, you will spend a lot of time mobilizing the dural tube. People with arachnoiditis, this is, from my point of view, the treatment of choice, although it exacerbates the pain at first. Because what you're doing is you're mobilizing the whole membrane system within the spinal canal. If there's inflammation in there, it's the way to get the inflammation taken care of, but it's also painful in the process. And her dural tube feels just fine. If you have questions about it, you can go back to that sacral hold down below and just do the sacrum and bring the dural tube to you, and you can use the occiput and bring the dural tube up towards you. But to exercise the dural tube, it's just a question of taking your two hands, occiput, sacrum, doing this until you get the response here, then going inferiorly till you get the response here and get a follow. And keep doing that.